And welcome to Deuk Spine and Joint Institute. I'm Dr. Deuk Majin. We are performing a piriformis muscle release on this patient who actually has multiple problems. One of them being bad discs, another one being a torn muscle in the buttock. And piriformis muscle is one of the most common causes of back pain. And it's interpreted as back pain, but the reality is it's buttock pain. So if you have pain in your butt and it's not your spouse, consider piriformis muscle syndrome.
Horribly undiagnosed.
Huh?
Horribly undiagnosed.
Yeah. Underdiagnosed. Massively underdiagnosed. Shot. So right where the tip of that probe is, Jordan, show them. That is the bone where the piriformis attaches. And this muscle is a external rotator of the hip. Shot. It literally, can you not get my hand, please? I don't want osteosarcoma of the hand. It would be really shitty having to die looking at your hand killing you. Don't laugh, Davis. Shot. All right, very nice. Any questions? I'm almost done.
Yes. We have a question from Robin on YouTube.
Yes, Robin, on YouTube. Shot?
Saying, I do have one question about L4-5 and L5-S1 bowel dysfunction. I take no pain meds and never have. If these discs have created bowel dysfunction / constipation, will the disc repair help this problem?
So first of all, I've never seen a disc cause bowel dysfunction. So I would not recommend the laser disc repair for your bowel dysfunction. I would recommend a gastroenterologist who knows what they're doing. I know what you're going to say. I've already seen 3 of them, 4 of them, 2 of them, but you need to see another one because I would never recommend back surgery for bowel dysfunction. Never. Now, there's only one thing that back surgery can fix bowel dysfunction, and that is if your bowel dysfunction comes from the use of narcotic painkillers that are causing your bowel dysfunction. Okay, so let's say you have horrible shot, sacroiliac joint. Let's say you have horrible back pain, you take painkillers, and that causes your bowel dysfunction. Then fixing your shot. I need to see that S1. I think you're L5. I mean, shot. Sorry, we're doing that's better. We're doing the SI joint. All right. So these procedures are being done with 4 millimeter incisions. Okay, that's how minimally invasive they are. Tiny incision. But I'm sorry, to answer your question, I just cannot recommend back surgery for bowel dysfunction. Shot? I mean, maybe there's another doctor out there that can do that, but I cannot. Shot? I would not recommend it. Shot? I mean, that's like the perfect spot, right, Jordan? I just feel like the Bovie's cutting. Luis, is it possible? Oh, it just doesn't feel like it's cutting very well. I don't know, is there char? It's working. Right? Shot. Trying to get down to where this pain nerve is. Huh? Shot. Shot. I mean, that's like the perfect spot right there. There's a lot of arthritis here. My God. Shot. How are we doing, Dr. B? Yeah. I think so. Shot. I mean, I got to see the sacrum better on my side, Jordan. I don't know why. I can see it better on the other side. Maybe move the machine away from me. Shot. Well, what do you think? Shot. Sorry, folks, I gotta focus right now on what I'm doing here. I'm trying to help this man. It's a fibrous part of the joint. Shot. So what I'm trying to do is destroy his pain nerves that are literally sitting here just outside his joint. Shot. Shot. When I say shot, I'm asking for a picture. And the picture I'm asking for is an X-ray picture. Shot. Shot. Any questions?
Yes. So now we got a couple questions. First one coming from Ping on Facebook,
Yes, Ping.
asking, can one bad disc cause the other disc around it to go bad too?
No. No, it cannot. If you have a bad disc, then it's from trauma. And the other disc, if they go bad, that's because they were injured during trauma as well. But one bad disc does not make the other disc go bad. Now, if you fuse a disc, it can make the other ones go bad. Shot.
This next question comes from Tracy on Facebook.
Shot. Sure.
Tracy asked, how many incisions do you typically do per side of the SI?
I do one. I do one, but everybody does it different. I do one incision. I mean, if I need to do two, I'll do two. But generally speaking, one is enough most of the time. Wipe, please. And pressure. All right, we got to change the tip. Luis, I need you to hold pressure when I'm not there. Okay. Otherwise, there's bleeding underneath, and then it causes pain. And the patient's. All right, how much more time do we have? I got 6-7 minutes. Did I already make an incision? No. Shot. Hip. Shot. Let's get that lined up. Let me know when you're ready. Shot. Shot. Oh, he's got the best anesthesiologist. Well, let's put some more num-num then.
We have a few more questions.
Yeah, go ahead.
Next one coming from Sherry on Facebook. Asking, I had a fusion on my neck years ago. Lately, I have been waking up with a terrible headache at the base of my neck if I have slept on my back. What would cause this?
Sherry, the most likely cause, and I could tell you exactly what's causing it if I could see your MRI and do an exam on Zoom. So I encourage you to take advantage of our free MRI review. I personally meet with you and go over it. But the most common reason that you would have those symptoms is facet syndrome, F-A-C-E-T, facet joint syndrome. And as a matter of fact, Henry is right now working on releasing on our YouTube channel the latest and best cervical facet joint video ever made. Shot?
Indeed, I am.
Huh?
Indeed, I am. Should be having it either later today or first thing tomorrow morning.
Thank you, Henry.
Not a problem.
He's doing great. You feel me, Davis?
Yeah, I haven't really felt an obvious pump. I don't always feel it.
I feel good though. I'm in the right spot. Shot?
You're in the right spot.
Mm-hmm. Perfect spot. Just about done here, but I can feel the tendon.
Funny when you feel the tendon, then all of a sudden you don't feel
We have another question.
Yeah, it's pretty cool. Shot? Yes.
Coming from Tracy once more on Facebook, asking, how helpful are injections for diagnosing piriformis syndrome?
Very, very helpful. Pressure, 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 pressure. Come on, Luis. They are the best diagnostic test there is for piriformis syndrome. Shot? There's nothing better. Yeah, he's moved a little bit. It's fine. Shot? The gold standard, north, right to Luis. The gold standard for diagnosing piriformis or SI is diagnostic block. Shot? That's a better picture. Almost done. 3 minutes. Shot? All right. Not bad. So I think he has a lot of scoliosis because this side seems to be a little better than the other side, more posterior. All right, I'm going to head up to do that L5 shot. Keep the questions coming. Shot?
Next question coming from Ping once more on Facebook, asking, did I hear on previous videos that there may be a documentary coming out about Deuk spine?
Yes, there's not going to be a documentary about Deuk spine. It's going to be an expose of the corruption in the spine industry and how patients are the victims. I wouldn't call it a Deuk spine documentary because the reality is, unfortunately, if we do a Deuk spine documentary, it probably will not get picked up by Netflix. And Netflix, we want it picked up by a big streaming service. That way, more people will see it. But it is a expose on Basically the spine industry. Just a couple of minutes, yeah. This is a very, I don't know if Jordan is giving me an unusual view. Is this the standard view, Jordan? Just, I need the standard view. Shot. That's better. You can see the ostia there. Huh? So yeah, I don't know if that answers your question there, Ping, but we can't do it on Deuk spine, but we can do an expose. All right, well, I hope this helps him.
Sitting on, please. Thank you.
We may have to repeat the SI if it doesn't. We'll see. But by the way, for those of you wondering what's going on, this patient has some heart issues. Not right now. He's done beautifully, but he has stents. And as such, we're very worried about him being under anesthesia. Could stress the heart. Yeah, he's got sleep apnea on top of it all. So, you guys see the 4mm incisions?
Yes, we do.
Anyway, we did the whole surgery through 1, 2, 3, 4, 5, 6 little cuts. And that's because he had sacroiliac pain, he had piriformis pain, he had sacroiliac, 3 discs that were causing his pain. So we're able to treat all those causes. The only one that I don't feel great about is the SI joints, but we'll see how he does. If we have to repeat those, that will be easy to do and quick. But again, I'm trying, when you're doing surgery as a surgeon, you don't want the surgery stressing the patient to the point that they have a complication, like a heart complication or a lung complication or a bleeding complication. So you have to take into consideration their medical condition during your surgery, and we're doing a lot for him today. We're kind of pushing the envelope, pushing the limit on how much surgery we're doing, how long we're keeping him under anesthesia. And so you got to balance it out. You have to talk to the anesthesiologist as a surgeon and make sure that, you know, the anesthesiologist feels comfortable with where the patient is, that they're not going to have a heart attack. And you basically have to try to move quickly and get everything done quickly so the patient can be woken up and get back to normal. Because this type of surgery stresses the patient's heart and lungs, because they're laying on their belly and they're breathing on their own and they get tired. I mean, can you imagine you try to lay on your belly and breathe for an hour? I guarantee you won't be able to do it. You'll feel like you're suffocating, you'll want to flip over. So that's what we have to deal with, is the patient's muscles get tired. Their diaphragm gets tired, their rectus muscles get tired, they have difficulty ventilating, and we don't have a tube down, so we can't ventilate for them. All right, DLDR, I'll come answer questions. Type them up, and I'll come answer them for you. All right, let's show our audience one of our videos.
I'm here with a gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the laser and we cleaned out 2 discs that were really causing pain in your back. They were herniated and starting to degenerate. How do you feel today?
10,000 to 50,000% better. Absolutely wonderful. I can't even, it's hard to explain. Going from not being able to walk 5 feet to being able to almost just walk around the block. It's one day, I mean, it's 24 hours. It's incredible.
And when did you realize you had this relief on your back?
Yesterday, when I got home and got settled down, and there was no pain. There was no pain in the back. There was no pain all the way down the leg to the big toe. It was like, where'd the pain go? It just dissipated. And that's after surgery. So usually you feel like there's surgery, there's going to be some pain. No pain. I can't even explain it.
Well, you're doing a good job. What was life like before you had the Deuk laser disc repair surgery?
I didn't want to live this way. There was no way I would never want to live that way. Never want to, no. Excruciating pain. I mean, can't sleep, awake all night. The pain was constant. It never left, but you got so exhausted from feeling the pain that you would finally fall asleep. I would finally fall asleep anywhere from an hour to 2 hours at the max. And 2 hours was a gift. And that's all night long. I had to sleep in the room by myself because I would have kept my wife awake all night. I was just miserable. The most misery I've ever felt.
I met your wife. She's a lovely lady. She's by your side all the time.
Yes, sir.
It's hard when you have so much pain. It takes a toll on you, but also your loved ones.
Yes, it does. And she's been a God's gift. I will say that.
Now, how does she feel about your surgery you had yesterday?
She's very happy for me. She's been through every day of it. And this started before Thanksgiving. And we are 3 days from Christmas. And I'm going to have Christmas without pain. Thank you, God. Thank you, doctor. Thank you, everybody in the staff. This staff is unbelievable. Nicest people I've ever met.
Well, we care about people like you. We want you out of pain and happy and getting on with your life. And tell me about your job. You have an interesting job.
I do. I love my job, and I call it the greatest part-time job in the world. One of the highlights of my job is something I can say about it is it's a job where you can say no to work and you'll have a job the next day. It's the only job in the world that I know you can do this. I'm a stagehand with the International Alliance of Theatrical Stage Employees out of New York, and I love my job. I do everything from entertainment, theaters, arenas, to trade shows.
What's the best show you did?
I've worked with two out of four Beatles. I've worked with, everybody from Kenny Rogers to Celine Dion. I've worked with Van Halen. I've worked with all big entertainment. And then I've done a lot of medical trade shows, so I know where I'm at. When I come into a medical facility, I look around and go, oh, I know where that comes from, and I know where that comes from. And it's a great job. It's a wonderful, wonderful job. I see things before normal people see things. I saw the first flat screen computer and I didn't think too much of it because I wasn't a computer person. Now it's like, look at the flat screen TVs, and it's a great job. That's the trade show side. The side where what keeps our country moving is people buying and selling the products that we use, from the cameras that are on us right now and the lights that are on us right now to doctor's coat that he's wearing and the shirt that I'm wearing. So,
and probably some of the equipment we used in your laser spine surgery.
Absolutely. The best shows I do, I have to say, are the medical shows, because I go around and I get literature and I read and I learn from past experiences with herniations. I've had double hernia surgery, so I know about that. I've had hand surgery, I've had knee surgery, now I've had back surgery. So I learn, and it's, you get to talk to the people that do the work and represent the products, and it's pretty awesome. So I love my job. I miss it. I honestly miss it.
Well, now you're going to be able to go back to work without that pain.
Oh, thank God. Thank you. Thank you, Doc.
You're welcome. Is there anything else you want to say to your fans out there?
If you're having issues, any kind of issues with back, knees, joints, you need to come to Deuk Spine. You just have to. The Institute is wonderful. Everybody here, there is no negativity in this building whatsoever. It's unheard of out there. And I've seen a lot of doctors over the years for different reasons, but there's no negativity here. It's all positive, and you leave positive. So I'm very, very happy that I did this. And I tell anybody that has ever gone through any kind of pain, you need to come see Deuk Spine. People come from all over the world, and now I know why. I just came from up the street, so I can tell you, up the street or from another side of the country, just come to Deuk Spine. That's the best I can tell you.
Well, thank you for sharing your story. Congratulations and Happy New Year.
Happy New Year and Merry Christmas to the whole staff. All your people are excellent, to your family as well, and their families. And I hope everybody has a wonderful Christmas. And by the way, the office is magnificent. That is the best I've ever seen. That shows when you walk through this office for Christmas holiday, it's all about family. It's all about the holidays. It's about the people that come through.
Thank you.
Thank you
you very much.
All right. Why am I showing you a Princeton tiger? My son is coming home from school in a week, and I'm very excited. He's going to spend the summer. What did we just complete? We just did a surgery that I'm going to have to use 2 models to show you. But this is your spine. This is the sacrum. This is the hip bone. The buttock is here. Can you guys see that?
Yes,
The
we
buttock
can.
is here.
Yep.
There's a muscle that runs right through here, and it attaches to the top of the hip right there. You guys see the top of the hip?
Yes, we do.
Okay, it's called the piriformis muscle. It's right where my hand is. And it gets torn all the time by patients who are in pain. Because when you're in pain, you can't bend and twist and lift things properly. So you're like trying not to set your back off. So you bend a certain way and you rip that muscle. This patient has done that. So we just completed a piriformis release. I pioneered this technique. It's done minimally invasive, 4mm incision. And I basically cut the muscle off the top of the femur. Okay, so there's this piece of bone right here. Oh, this is so annoying. There's a piece of bone right here at the top of the femur called the greater trochanter, and the piriformis muscle attaches right here. And I went in and I basically cut the attachment of that muscle. That is a release. It's called a piriformis muscle release. I did not do the first piriformis muscle release. Somebody smarter than me did, but we did it minimally invasive. We're the first to do that. I pioneered that technique, and it's here at Deuk Joint Institute, Deuk Spine Institute. It's 4mm incision, almost bloodless surgery, and the pain usually goes away right away. So it's an amazing procedure. We just finished that. This patient presented challenges. He has stents in his heart. That's bad. Stents means coronary artery disease. It means he had narrow arteries, not enough blood, high risk for heart attack. Nobody would touch this guy. They all want him to live in pain, right? But he doesn't want to live in pain. So he came to us. I did the procedures. We pushed the envelope. We took a lot of time in the OR, but I worked quickly and efficiently. I'm just a little worried about the SI joints. I don't know if I got all the nerves. I tried. The shape of his joint is very weird. It's very deep. If we have to, we can bring him back and do it again. But I would rather he get through this surgery safely, make a full recovery, and then come back and get a repeat on his SI joints. No cost to him, of course. We take care of it. But what we're trying to do here with the SI joints is I'm trying to deaden the pain nerves all along the joint here. Okay, and the problem is the shape of his joint, because his iliac crest goes back so far. Getting here was very difficult to get to, all right, because it was deep. And so I was in there messing around, and meanwhile in the back of my head the whole time I'm hearing this voice like, hurry up, this guy needs to get out of here. He may have a heart problem. We got to get him out, get done. So I'm just being honest with you. Surgeons do worry about things while we're operating. Good surgeons worry, and I feel I'm a good surgeon. I hope I did a good job. I hope it's good enough, but it may not be. With the SI joints, I think the rest of it was perfect. With the piriformis release, I could feel the muscle release. With the discs, I feel like we got the disc fixed. So worst case scenario, 70% pain gone. Best case scenario, 100%. Somewhere in between there. All right, what questions do we have?
This first question coming from Ping, once more on Facebook, on the follow-up of their question of the documentary. They asked, when is it due out and how do people watch it?
Well, Payne, great question. First of all, we are shooting the film in June. I want to say it's 4 weeks of shooting. It's in San Diego. We've already auditioned for the actors and actresses, and we've already got the locations for all the scenes locked down. I don't want to spoil the movie for you all, so I can't really say too much, but I can tell you the name of the movie. It's called Spine Scam, and I can tell you the name of the main character. I probably shouldn't be saying this stuff. I mean, I'm going to get in trouble, but since I'm the executive producer, I guess I get to.
Yeah.
Yeah, I mean, why not, right? I could leak a little.
You do your thing.
Yeah.
I'm here.
So, you know, we didn't want to make it too obvious, but the name of the good spine surgeon in the movie who is the pioneer with the revolutionary minimally invasive treatments that work, his name is Dr. I didn't pick the name, but I like it. Dr. Deuk Mender.
I love that.
So it could not be Dr. Deuk Majan because Netflix wouldn't go for that, or the other streamers would be upset. But I probably, somebody's going to yell at me for saying this, but Dr. Deuk Mender is the protagonist in the movie, and it's the first movie in hopefully a series. If it's picked up, we want it to be picked up. I think there's a lot to talk about. We talk about insurance, not in this movie, but very briefly about insurance. In the next one, we would talk more about insurance and how the insurance companies are scamming everyone. We talk about the hospitals and how they're closing and how access to care for patients is going to become limited, which is what the insurance companies want. I mean, there's so many things I could talk about that I've learned over the last 25 years, you know, being in medicine. Actually, I've been in medicine now for 54 years because my dad was a doctor, and I watched how medicine was conducted back in the 70s and 80s. My dad was a military surgeon, and he was stationed in Germany. I was born in Germany on a U.S. Army base. That's why I was born overseas, but still an American citizen, because my dad was a doctor in the Army. And I got to see how medicine was practiced back in the 70s and 80s. And the reality is that it was much easier to practice medicine, better for the patients, better for the doctors. But the insurance companies have, in the last 40 years, developed these strategies that allow them to basically be more profitable now than ever before. They're making record profits. And the reason why they're able to be more profitable is basically denying treatment to patients, denying testing and denying treatment. And the way they do it is just, there's like literally 100 different ways they do it, maybe 200. And so all that needs to come out in the series so that the public is aware of the treachery of the insurance companies and how they're keeping people from getting the best care in this country. You've watched America, our country, when I was a kid, you know, back in the 80s, America was #1 with healthcare in the world. And it's not that, you know, the criteria has changed. It hasn't really changed. It's that the quality of healthcare in America has deteriorated over the last 40 years. And now we're ranked last among developing countries. And that's because, not because doctors do a bad job, it's not because hospitals do a bad job, it's because the insurance companies have literally siphoned all the money out of healthcare into the pockets of, you know, lobbyists and venture capitalists and the few rich people, and they've taken all that care away from the patients. Patients deserve better. People deserve better. Health is the most important thing in life. If you don't have health, I mean, you have nothing, you know? You're miserable. I know this firsthand. I've had my own health issues, my sinuses, my eye, and long story short, I think people deserve to know the truth. So that's what this movie series is about, getting the truth out there. And it starts with Spine Scam, which is the first movie in the series. And if it's picked up by Netflix, then they're going to take over everything. But, you know, it's too early to say if Netflix will pick it up. We don't know. But we do like the script, we do like the storyline, and we've got some really good actors and actresses, so hopefully the public will like it, and, you know, we'll see where it goes from there. But I've given away the name of a character who plays me in the movie, and Dr. Deuk Mender. But that's all I can say, so stop asking me questions about the movie.
Done and done. Next question coming from Tracy once more on Facebook. Asking, is it possible that sciatica associated with piriformis to refer pain more down the IT band rather than down the back of the thigh and down to the top of the foot?
Yeah, great question, Tracy. Tracy's asking a very good question, and that is sciatica from piriformis muscle syndrome, which is what we just treated in this patient. She's asked about the pattern of distribution of the pain, if it could be different than a sciatic, you know, typical sciatic nerve pain. The answer is yes. It is on a case-by-case basis. remember your sciatic nerve comes out through what's called the sciatic notch in the back behind your hip, comes out through the sciatic notch, and the piriformis muscle runs, basically the sciatic nerve runs through the piriformis muscle. So when the piriformis muscle is torn and inflamed and swollen and angry and trying to heal but can't heal, it gets all that inflammation on the sciatic nerve, it puts pressure on the sciatic nerve, patients get sciatica. Not everybody with piriformis has sciatica. About 60% of the patients do, 40% don't. So the pattern of distribution is going to vary, just like, you know, people vary with respect to their appearance, their hair color, their eye color is just variable. Could it be on the side? Yes. But really the best thing to do is to have me make the diagnosis at Deuk Spine Institute. I can tell you what the source of the pain is, usually, and if I can't tell based on physical examination, which I can about 98% of the time, then we can do a diagnostic test where we would inject the piriformis muscle, or we would inject the iliotibial band, or we would inject the epidural space around the nerve root, and we would figure out where that pain's coming from with diagnostic blocks.
Lastly, coming from Ping once more on Facebook, asking also if someone has the laser disc treatment for the neck and say it re-herniates during sleep within the first 6 weeks or so, does someone paying privately have to come back and pay full price again?
Ping, unfortunately, the answer is yes. You would have to pay for the surgery to be redone if you re-herniate. That's why we give you a collar to wear for 6 weeks after your surgery. Wearing the collar, not lifting over 25 pounds, and avoiding contact sports, those 3 things reduce your risk of reherniation down to about 1 in 500. Okay, but it doesn't make it 0. I've had one patient reherniate while they were sleeping, and they had to pay. You know, the problem paying is it's not about money, it's about cost. And the reality is that somebody's got to pay for that surgery. And there is no government agency paying. There is no, you know, Bill Gates should be paying, but he doesn't. You know, Mark Zuckerberg should pay, but he doesn't. Who's going to pay? And so if your insurance doesn't pay, I can't pay. I mean, if I was paying for all my patients' care, I'd be broke. You know, I don't mind doing it for free, so I will do it for free. If I have to redo your surgery, I won't charge you. That saves you literally 5% of your charge, because the surgeon's fee and the anesthesia fee for the anesthesiologist, our fees for the surgeon and the anesthesiologist is 10% of the cost. So my half is 5%, so we could save you 5%. Yes. All right, is that it?
Yeah, that is it.
All right, well, I hope you enjoyed the surgery. Who is that, Cassie? No.
Close.
We will be back on Thursday. I think we have a cervical fusion, ACDF, a patient who is not a good candidate, by the way, for Deuk laser disc repair. She wanted it, but I said it's not going to work. You need a fusion. So we're going to be doing an ACDF on Tuesday, along with a bunch of others. I'm sorry, Thursday,
Yeah.
along with a bunch of others.